All right, so something that we don't talk about enough, but that I do very frequently in my practice, and hopefully your vestibular therapist is doing something similar with you, is central peripheral integration. So that's when you integrate your central vision and your peripheral vision so that they're understanding the same thing at the same time. One way that I see that this is really difficult for some people is driving. So if driving is a really difficult thing for you, it's likely because your central vision, or your vision that is you're really, really focusing on, is still, and you can kind of focus on the street or the road in front of you, but then your peripheral vision, what's coming at you from your side windows, all of those things, that gets really blurry and more difficult for your brain to comprehend. And not integrating those two things is not so great for our brain. It makes it harder for us to process visual stimuli. It makes it harder for us to process what the optic flow or the picture going across our face actually is. So there are a couple different ways that we can work on central peripheral visual integration. One way that I like to do this is by using these glasses. Now, these glasses are just classic construction glasses. They're not difficult to find. They're a couple dollars on Amazon. You can also use glasses with the lenses popped out that you just kind of put tape in. But as you can see here, I've taped the central part of this. So when I put them on, my central vision is taken over by blurriness, and I can only really see out of my peripheral vision. Now, the important thing to think of when you think about maybe using these or doing visual integration between your central and peripheral integration is not to do it alone. Always use a qualified therapist to help you through these exercises and to make sure you're doing them correctly, right? That's something that's really, really important because doing these incorrectly can do harm. Again, this is never medical advice and should not be taken as such. So depending on my patient's ability, I have them put their thumbs out to the side here and then kind of wiggle their thumbs like this and see where in the range of motion you can start to see your thumbs. It honestly should be pretty far out here. I can see my thumbs wiggling and my fingers are basically in line with my shoulders. Now notice that my eyes, with the exception of when I look to see where they were, are not moving, right? I'm not looking this way to see my right thumb moving, and I'm not looking that way, this way, like that at all to see my left thumb moving. I'm just moving my thumbs like this and seeing if I can see them. How far back that goes, right? And we want to be sure that we're staring at something ahead of us and then seeing if we can see our thumbs or fingers or whatever you want moving. There's a lot of different ways to do this. And because there's so many ways to do it, I'm just going to give you a couple simple ones. And then of course you can ask your therapist about these and how to progress them for you. The next way that I like to do this is by sitting and using these glasses. So now I cannot see straight forward out of these glasses. So I can see looking straight forward, again, not moving my vision or my gaze at all. I can see out my peripheral vision. I can still see my thumbs moving all the way to here, but when I get here, I can no longer see my thumbs. I can see them kind of through this blurry tape, but not a ton. So this can be helpful for some people and actually make some people feel better by giving you this locked in space to see if there's less tape, right? So you don't want to just wear these around all the time. That would make you probably not feel so great, make it really easy to knock into something or fall over. So again, that's not safe. And I do recommend that someone be nearby to make sure you're not running into anything, especially as you hopefully get better at this, because when you first start out, you might not be so good at this. So what I recommend you to do is put these on and just sit. Now, what I have patients do, and again, not necessarily recommending you do this, even though I just said that, but what I have patients do typically is sit here with these goggles on or glasses on or whatever they're using and see what they can see outside their peripheral vision. Over there, without moving my eyes, I can see a television, a cabinet, a box. I can see on this side a white bed, a blanket, a headboard over there. I can be aware of my surroundings. I know that there's a mirror over there I saw before I sat down. Below me on my right and left, without looking anywhere, I can see these two handles on this chair that I'm sitting in. So I've got all that without moving my eyes or my head at all. And of course, as I move my head now, I can see my computer without moving my gaze, but I've moved my head, and again, my gaze is staying forwards. So that's step one. Just can you see out of your peripheral vision and use it as another way to see? Because you should always be using both your central and your peripheral vision. The next thing that you want to do is do the same thing standing. And then the very last thing that we do with this exercise is walking. And we can add dynamic challenges by me holding up how many fingers am I holding up and asking someone to tell me how many fingers I'm holding up and if they can read it or not out of their peripheral vision, and slowly getting more and more and more peripheral until, of course, you can't see anymore. So I hope that was helpful in how to do central peripheral visual integration exercises. I'll see you in the next video.